Dr. Nicha, I would like to learn more about the EndoliftX program. There are a lot of questions we have, but I'll start one by one. First question is, can you tell us a little bit about the difference between EndoliftX compared to the non-surgical face lifting program procedures?
Oh, well, as simply as this, because most of the procedures that offer in nowadays technologies, they only can deliver energy source on the top part of the skin and let it goes towards the deep part of the skin, then those energy will promote the new collagen production. When we speaking about EndoliftX, which is a thread mark, so it's a specific wavelength of laser that is delivered through a very fine fiber optic that is inserted underneath the skin to the skin deep, and then we started to release the laser beam. Those energy from the laser beam will create a huge amount of new collagen production, as well as it can eliminate part of the excessive fat under the skin altogether at one go. Then after that, the skin on a treated area will be regenerated with a new bunch of collagen and less excessive fat. And you can see from the 3-dimension, the skin is reformed, lifting, and then, the quality of skin is also back to a very, very good one. Yeah.
I see. Thank you. Dr. Nicha, you just mentioned about a specific wavelength being used. Can you tell me more about that?
Oh, sure. The specific wavelength is a 1470 nanometer. It's a wavelength that is approved by scientific research for over 10 years. That is the most captured water and the fat cells. Why we choose this is because the scientific is proved that it is the most potent specific wavelength that can promote new collagen and can eliminate the fat.
I see. That's very good. Thank you. I think a lot of our friends would like to ask the question whether any pre-existing medical condition would stop them from doing this EndoliftX program.
As you can see, EndoliftX is a very non-invasive procedure. We only have to numb the area with a local anesthetic solution, and then after that, we will insert the optic fiber underneath the skin, and the area where the laser is going to be working only takes about 1.1 millimeter in diameter. So it is a very fine work of art, and when we move to the specific places, it only can shoot on a certain area. So basically it's safe procedures for most of the patients, except for they really have a history of maybe photoallergic, specifically, or autoimmune disorders that has linked to the photosensitive, pre-existing disorders or some stuff like that. So we need to ask their personal physicians first whether they are safe to do that. Apart from that, I think even for the poor wound healing, like a diabetic people, if they have a very good control in average of blood sugar, they also can do this procedure safely.
That's great.
For those who are taking blood thinner or some supplements that can thin blood, we will recommend they consult with the supervisors or their physicians to, see if they can hold it for a while. Let's say, for example, less than a week before and after the procedures. Other than that, I think they're very good to go.
Make perfect sense. Thank you. Dr. Nicha, I'm very sure it's a very safe procedure, but can you highlight to our friends what are the safety features or procedures we have in place during the actual procedure being done?
I see. When we talk about EndoliftX, this technique will be considered as a minimal invasive procedures. First of all, you only need local anesthetic solution. That before we are going to start the procedures, we will take a clear history. We will make sure the blood pressure, the body weight, and then we calculate the amount of anesthetic solution
Yes.
per kilograms of body weight before we are starting, the procedures. That's the first safety that we need.
Right.
And then during the procedures, we don't need to do the general anesthetic, procedures at all. Patients will be comfortable lying in bed. They can just relax and listen to the music as they wish.
Yeah.
And then we just deliver the energy on through the treated area.
I see.
Yeah, so basically it's very safe procedures.
And it's also a relaxing period. Dr. Nicha, in terms of the EndoliftX procedure compared with other surgical alternatives, would you kind of give us some thoughts about what are the differences?
First of all, if you have to deal with a surgical procedures, you would definitely have to deal with general anesthetic procedures. Okay, you need to be anesthetized.
Yes.
You stay unconscious in bed, and some of the surgical procedures included with the cutting and then lifting and suturing and all these will leave scars and marks afterwards. Or it may progress to a larger scar that grows, which is known as keloids.
Oh no.
Yes, but after the surgical facelifting, for example, the skin will look stretched and tight as well, but you won't get the good quality of the skin afterwards. You only get the feeling of getting tight, or lifted. But afterwards, you will still need some modalities to improve your skin quality as well.
Yes, correct.
Whereas EndoliftX can do it all without surgery, without scars, minimal downtime, and no general anesthetic procedures.
I see. Thank you very much. I've heard about EndoliftX procedures can actually help you kill the fat cells. Can you tell us a little bit more about that and then compare to liposuction?
Yes, actually we have mentioned at the beginning that the specific wavelength of EndoliftX, which is 1470 nanometers,
Yes.
the chromophore that is specific for this wavelength is water and fat. So when we shoot that in an appropriate amount of energy and appropriate time of delivery of energy, the fat cells will be burst, break down, and eliminated by our own body after. So you are looking at some procedures that is non-surgical at all, and you can say goodbye to fat cell forever on the specific area. Whereas if you do the conventional liposuction, you will still need to be under general anesthetic.
Yes.
You will need to have scars because they have to cut and then insert the probes and then do the conventional liposuction. And then you will have to take risk from the conventional procedures such as the embolism that can throw to your brain, that can block your lungs, that can block your heart, or it may travel down to the legs and block the circulation, and you can have paralyzed or hemorrhage, which is a serious consequences.
Indeed. Thank you. Dr. Nicha, let me ask you a question. Who will be the best candidate for EndoliftX procedures?
Well, as we talked, we expect to see some lifting and tightening effects.
True.
So anybody who has laxity on the facial areas, included with the upper eyelids drooping, the heavy eye bags, the heavy cheeks and jaws, the non-defined jaw lines, double chin, and then very heavy neck. Those are very, very good for EndoliftX,
I see.
Apart from that, as EndoliftX can, do the tightening and also fat elimination, we can apply EndoliftX to some certain parts of the body. Yes, for example, for the stubborn fat around the belly button, the muffin top,
of course,
which everybody doesn't like, and no matter how hard you exercise, it won't go away.
True.
This is a very good candidate.
I see.
Look at the belly, the love handle, the brow lines, and the hanging, drooping arms,
Right.
the inner thigh that is too big, too chubby, or we can eliminate the certain chunk of fat that collects under the buttocks. We can lift the hip, sculpt the shape of the hip, make the nice curve, and down to the calves as well. So basically, EndoliftX is benefit for most of the part all through your body.
That's great. It's good news.
Yes, it's a good news.
Indeed. Let me ask you, what would be a patient anticipate after the procedure?
Oh, you mean the results? Oh, as soon as they finish the procedures, they
Yes.
will see the tightening and lifting effects almost immediately. But then later on, about half an hour, then the tissues will start to react to the energy. Of course, with the amount of anesthetic solution that we injected, altogether will make a bit of the certain degrees of swelling. But don't be scared. We will have a bandage like for facial garments and stuff for patients to wear afterwards. Within a week, they will start seeing the change more drastically. And then after that, each day, each month, they will see improvement. Up to 3 months, we consider to see about 50% of the improvement.
Yes.
And then they will reach maximum of 100% improvement within 6 months' time. After that, if they still have problems that they want to come back and address more, they
Yes.
can repeat the procedures on a specific location as well. As you can see, the result is very, very depending on each individual's medical health and
Certainly.
conditions as well.
That's great. Thank you. How about the general lasting of the procedure? Will it last long?
Of course, we have to look at the age where we first start to do these procedures.
Yes.
Most of the study, they're looking at the participant that is age around 35 to 40. That age, the degradations of collagen will still be in the middle of the way.
Right.
When you do EndoliftX in appropriate energy, of course, they claim that these procedures will last up to 2 years. And even in my opinion, in my experience, if you have a good skin condition from the beginning, maybe this effect can last longer than 2 years.
I see. So it's very fair. Thank you. Dr. Nicha, in terms of recovery, anything that we need to concern about this period?
Oh, for example, we had mentioned about the swelling, and some people, they have a very bad skin quality at the beginning, and the reaction is going to last a little longer. But it's not as bad as people cannot go out or do the daily activity at all. Some patients after procedures, they rest for a day or two, wear facial garments, and then the third day they can start working like normal, or can just wear like face masks and get going.
Right.
Some people who doesn't have a bunch of fat to eliminate it, almost invisible swelling at all. So they were saying that it's very convenient procedures. For those who have a very chubby chunk of fat that, for example, under the chin, they may see swelling that may last for certain weeks, but it's acceptable within a range of exception. For the bruising, will it be visible? I have to say, frankly, the fat cells does come with the vessels that feeds them. When we break down the fat cells, of course, those small blood vessels is going to break down as well at the same time. So the small dots of bruising will be visible, but it will be eliminated by our own body within a week or so. Yes, that shouldn't be any worry.
Right.
But one last thing that I noticed that what Endolift can make people worried a little bit about it is just the numbness that could last up to certain weeks, depending on the area where we're working on.
Right.
But some sensitive area like bony area, the jaw lines, they may feel tinglish or some light, discomforts when touched. But, in everyday basic, they can apply the daily cream, they can wash their face, they can touch it, but not to press it too hard. But that is within acceptable range as well.
It's very fair. Thank you. Dr. Nicha, could you tell us about how long does the actual EndoliftX procedure takes?
I see. For example, if you want to treat just for upper and lower eyelid problems, I would say it only takes about an hour to finish the whole thing. But you know, if you're looking at lifting the full face, included with the double chin, it probably takes about 2 hours already. And included with the neck treatment, it maybe takes about 3 hours altogether.
I see. Thank you. Dr. Nicha, in terms of like preparing to do the procedures, anything that we should know?
Of course, it will be just like another preparation for all the procedures. First of all, we need to know the existing illnesses or condition that we have to pay attention to.
Yes.
Especially if you are taking blood thinner, or you are diabetic, or you are a smoker, you are, you know, you drink often or regularly. We need to make sure that all the conditions can be, you know, managed, you know, before we start the procedures. For example, if you are taking blood thinner, you need to sit down and talk to your physicians whether you can hold it for certain days before and after EndoliftX procedures. But it only needs about 24 to 48 hours to hold blood thinning, you know, supplements or medication,
Yes.
you know, before and after, to my experience. Other than that, should be okay. But for people who need some medicine that may react with local anesthetic solution that we are going to give to them,
Right.
then, you know, they need to sit down and talk to the doctor as well, whether there will be some concern about the amount of use, so that we can get back and sit down and talk to them for the certain area that we can treat them for a time for
Yes.
the best safety.
Make perfect sense. Thank you. Dr. Nicha, in terms of having the EndoliftX procedure, can it be combined with other aesthetic procedures?
Of course. So far, as we need to improve the skin quality in one go, we may look at some biostimulator substance that
Right.
we can deliver to the skin, you know, immediately after the EndoliftX is finished. And that will enhance the signals of the skin rejuvenation afterwards. So the result is expecting to last longer and more visible.
I see. Thank you. Dr. Nicha, I understand that Thailand is one of the leading country operating the EndoliftX program.
Yes.
And you are the very first trainer authorized by EndoliftX in Thailand to train a lot of physicians in this area.
Yes.
Would you mind share some of your observations towards this program?
Oh, sure. Towards more than half a year that we have been working on this technology together with the company, I was very, very much honored by the team to get started first, and then after I try to, you know, deliver this technique to most of the doctors, I would say this is a state of art that needs a lot of hand skilled. The person who can operate them harmoniously, let's say, you need to have a background and know-how of surgical, dermatologist, meaning that you know your skin very well,
Yes.
in terms of anatomy, molecular, and then the laser basic. So it is a very good combination of all that I have mentioned
Yes.
to create the maximum result and impressive results for EndoliftX.
Thank you very much.
You're welcome.